Anyone who has ever experienced trauma, which is about 50% of women and 60% of men, knows that it can shake our confidence and turn our world upside down. In this video, we're going to explore different types of trauma, how trauma can affect us, and how we can begin to heal from trauma. According to the American Psychological Association, trauma can be described as an emotional response to a terrible event like an accident, rape, or natural disaster. When we think of trauma, we often think of a terrible event happening to us, and this is known as primary trauma. But it's important to acknowledge that there are other types of trauma, including secondary or vicarious trauma, generational, acute, chronic, and complex trauma. Let's take a look first at primary trauma. Primary trauma is an extremely distressing event, possibly even life-threatening, that happens directly to you. Examples could include child abuse or neglect, physical, emotional, or sexual abuse, the traumatic loss of a loved one, vehicle or other type of physical accident, traumatic brain injury, sexual assault or rape, physical assault, being involved in a natural disaster, being involved in a mass shooting, bullying or harassment, war or military combat, terrorism, and domestic violence. Primary trauma can be acute or chronic, which I will describe more in detail in just a moment. Secondary or vicarious trauma describes a type of trauma that you experience indirectly. This may be in the form of hearing about, reading about, or seeing the trauma happening to another person or animal. In fact, the term vicarious trauma was coined by psychologists Dr. Lori Perlman and Dr. Lisa McCann in 1989. They realized that you didn't have to personally experience a trauma to be impacted by it. Now, this later formed the concept of compassion fatigue. And in the 90s, trauma specialists, including Dr. Charles Figley and Beth Stam, were researching why those who experience vicarious trauma began to develop symptoms that were similar to PTSD. This led to the concept of secondary traumatic stress, which we know today to be a component of compassion fatigue. Now, compassion fatigue is especially common in the helping fields, including healthcare, law enforcement, and animal welfare. And this type of trauma can also be acute or chronic. Generational trauma, sometimes referred to as intergenerational or transgenerational trauma, was brought to the forefront in the 60s. It recognizes that not only do our ancestors pass down certain characteristics, such as eye color or personality quirks, but their trauma can also be encoded in the DNA that's passed down from generation to generation. So, for example, the effects of slavery, the Holocaust, the genocide of indigenous people, or other types of extreme stress can be felt in even the grandchildren or great-grandchildren of those who experience the trauma directly. Populations particularly at risk for generational trauma include those born into systemic racism, poverty, violence, abuse and neglect, addiction, and oppression. Complex trauma refers to multiple traumatic events that generally occur in childhood and are perpetrated by someone the child should be able to trust, such as a caregiver. An example would be a child repeatedly witnessing domestic violence between her parents, being molested by a family friend, and being physically abused by her father. This type of trauma has long-lasting effects, including problems with interpersonal relationships, guilt and shame, difficulty regulating emotions, and even dissociation, which is an uncontrollable response to trauma where the person becomes disconnected from their thoughts, emotions, surroundings, memories, and even their sense of identity. Now let's look at acute and chronic trauma in a bit more detail. Acute trauma refers to a single distressing event that threatens one's security, and this could be physical or emotional, and afterward, whether you're involved in, hear about, or witness a traumatic event, it's common, it's normal to experience a variety of emotional and physical responses. This is called the acute stress reaction. You can expect symptoms to last anywhere from a few days to a few weeks, and these symptoms may include repeatedly playing the traumatic memory in your mind or refusing to ever think about it, which is avoidance. Difficulty sleeping, feelings of guilt or self-blame, anxiety or hyperarousal, sadness or grief, irritability or anger, feeling numb or detached, mood swings, recurring flashbacks or nightmares, trouble concentrating, avoiding people or places that remind you of the trauma, bodily complaints such as headaches, stomach issues, the inability to enjoy activities that you once found pleasurable, and this can include sex, a change in your entire worldview. So, for example, you now have an intense fear of danger or difficulty trusting others. You basically see the world as a dangerous place. Questioning your faith in God or other higher power. Now, if you are currently experiencing any of those symptoms, the good news is that you're completely normal. This is simply the brain's way of trying to process the crisis or traumatic incident. But if your symptoms last longer than a month, are causing you extreme distress, or are interfering with your daily life, you should consult a mental health professional to help you process, cope, and eventually heal from that trauma. Now, chronic trauma refers to repeated distressing events that threaten one's security, again, physical or emotional, and that may happen over a prolonged period of time. This could include repeated or long-term exposure to trauma, such as in the case of domestic violence or war, or being the victim of one trauma after another. For example, someone loses their job, then their spouse leaves, then they are diagnosed with cancer, and then they suffer a head injury from being involved in a car accident. With chronic trauma, symptoms may last for months or even years. Now, symptoms of chronic trauma may include trust issues, unstable relationships, emotional outbursts, extreme anger, anxiety, bodily complaints such as headaches, stomach aches, tense muscles, fatigue, flashbacks or nightmares, feelings of guilt or shame, dissociation, isolating yourself, risky or dangerous behaviors, low self-esteem, and even suicidal ideation. Now let's talk about perhaps one of the most commonly known mental disorders that involve trauma, and that is post-traumatic stress disorder, or PTSD. So all types of trauma can lead to the development of a trauma disorder, including PTSD. But for the sake of brevity, we are only going to cover PTSD here. Now, it's really, really important to remember that the diagnosis of PTSD is very, very complex and must be done by a mental health professional. While many people are exposed to trauma at some point in their lifetime, it's important to remember that only about 8% of the population will actually develop PTSD as a result. Now, the rates are higher among those in occupations where repeated exposure to trauma is common, such as in the military or animal welfare. Other risk factors that could make you more vulnerable include having a family history of depression or PTSD, having a coexisting disorder such as depression or anxiety, exposure to chronic trauma, brain chemistry, or even personality or temperament. Now, the following is not meant to be a substitute for a mental health assessment or treatment. I highly recommend that you do consult with a mental health professional if you suspect that you may have PTSD or any other mental disorder. But let's go ahead and take a look at some of the diagnostic criteria for PTSD. So some of the diagnostic criteria for PTSD includes exposure to actual or threatened death, serious injury, or sexual violence. Now, this exposure refers to direct or indirect exposure in person, learning about a trauma of a close friend or family member, or experiencing repeated details of traumatic experiences. Now, the latter does not include exposure from the media unless it's work-related. Let me give you an example. So seeing something that is graphic, traumatic, and upsetting on social media, for example, would not count as far as the diagnostic criteria for PTSD is concerned. However, let's say you are a reporter or a camera person for the news, or you are an undercover cruelty investigator for an animal welfare organization. This type of exposure would count because it is work-related. A person must exhibit at least 2 of the following intrusion symptoms: recurrent intrusive memories of the trauma that are distressing and involuntary, recurrent distressing dreams about the trauma or related to the trauma, dissociation or flashbacks of the trauma, prolonged or intense psychological distress when exposed to triggers, things that remind them of the trauma, and significant physiological responses to those triggers. A person must also have persistent avoidance of triggers, including one or both of the following: avoidance of, or efforts to avoid, distressing thoughts, feelings, or memories of the trauma. Avoidance of, or efforts to avoid, external reminders, so people, places, things, conversations, situations, etc., that provoke distressing thoughts, feelings, or memories of the trauma. In addition, a negative change in mood and cognition is required and must include 2 or more of the following: unable to remember an important aspect of the trauma, exaggerated and persistent negative beliefs about self, others, and or the world, blaming oneself or others for the trauma due to persistent distorted perception, chronic and negative emotions, so for example, anger, fear, shame, decreased interest or participation in activities once enjoyed, feeling detached from others, or chronic inability to feel positive emotions such as happiness and joy. Also included is a noticeable change in reactivity or arousal associated with the trauma, and this must include 2 or more of the following: irritability or anger outbursts, and this is typically without any or very little provocation, self-destructive or reckless behaviors, hypervigilance, which basically means always being on guard, increased startle response, difficulty concentrating, and sleep problems such as insomnia. Now let's talk about some ways that we can heal from trauma. Despite the pain that trauma brings, the good news is that our brain has this amazing ability to heal. From conception to old age, our brains are continuously reorganizing their functions, connections, and neural pathways. This process, known as neuroplasticity, is what allows us to grow, learn, and adapt to our environments. In the right circumstances, our brains can flourish. Negative events, however, such as abuse, neglect, and other forms of trauma, can also alter the structure of the brain and take a toll on neuroplasticity. Not only does this negative plasticity cause parts of the brain to shrink, but it also leaves trauma survivors struggling with chronic anxiety, depression, and a whole host of other emotional and cognitive impairments, as we've just learned. But just as these negative experiences have the power to alter the brain, so do positive ones. Psychotherapy can be a very powerful tool in the facilitation of positive plasticity, and it's helpful for a variety of symptoms. There are a variety of trauma-informed therapies, including prolonged exposure therapy and EMDR, or eye movement desensitization and reprocessing therapy. You can help the healing process by giving the brain what it needs to heal: movement and rhythm. The brain loves movement and rhythm. So, for example, dancing, drumming, boxing, cycling, roller skating, even taking a brisk walk in a safe and interesting place, and that's the key part there, a safe and interesting place, actually exercises the brain and allows survivors to work through those traumatic memories. Now, just as physical exercise can help to build muscle, mental exercises can boost brain growth. For example, the present-centered form of meditation known as mindfulness can help with positive plasticity. Some might find meditation or mindfulness practice to be a bit too overwhelming at first, so you might want to try guided exercises first. Instead of avoiding and stuffing your feelings down, try journaling as a way to process them in a healthy way. There is evidence that some medications can have a positive impact on plasticity, helping to reverse the damage caused by trauma. Know your triggers. By having an understanding of what can trigger negative emotions, you can better protect yourself by creating and enforcing boundaries, as well as control your exposure to trauma inputs. Self-care can help your brain and body build resilience and facilitate the healing process by staying strong and healthy. So as you can see, from medication to meditation and everything in between, there is hope for trauma survivors. By having a better understanding of how plasticity affects our brains, both negatively and positively, we can gain better insight into the devastation caused by the trauma, but the miracle of the brain's ability to bring us back.